Hello and welcome once more to Wellness with Will. My name is William, last name Lehong. So good to have you on the show today. We have our guest, Dr. Clementine Chawane, and the conversation today is to really help you, wherever it is you are, hearing our conversation today, to really understand what your mental capacity is and how you can help yourself. Doctor, thank you so much for making the time and for joining us here on Wellness with Will. Good to have you.
Thank you so much for having me. I'm looking forward to this conversation.
Doctor, you are a psychiatrist. Your job within this conversation of mental health is very crucial. We are at a stage, I think, as humans around the world, where we're trying to normalize going to therapy, seeing a psychiatrist, understanding, as I was saying in my intro, our mental capacity.
Yeah.
But where would one find the courage, firstly, to say, I need to go see someone about this?
Yeah. Look, you know what? Every time I see someone and it's like, I have a psychiatrist and a psychologist, I'm like, congratulations, you've arrived. You know? That's an American dream, you know?
Yes.
To have two shrinks on your side.
Right.
You know, it's such a good thing, you know, because
Sure.
then it means that you will be emotionally aware, emotionally intelligent, and like you said, be aware of your own mental capacity. What is it that I'm able to carry? So I know that people are usually reluctant to, because they think that we are gonna diagnose them and label them, and they're gonna be different members of society, and it's not that. You know,
Right.
The aim of a psychologist and a psychiatrist is to empower people so that they can live out their best life and help them clear whatever fog is on their way that is sort of like stopping them from achieving whatever goals. And sometimes the goal is, I want to sleep throughout the night.
Sure.
You know, and so we're there to help those kind of people.
And very quickly, Doc, please just explain to me the difference, right, between the psychologist and the psychiatrist. I know within your profession, those are two very different things,
Yeah.
but us unknowingly, we interchange the terms as if it means the same thing, whereas it doesn't really.
Yeah, no, it doesn't. So the difference starts with the training, all right?
Sure.
So the training is different. So a psychiatrist, which is what I am, is a medical doctor. So you go to medical school and you qualify as a medical doctor,
Okay.
and then you specialize in mental health, and then you become a psychiatrist. So if you see a psychiatrist, we look at the medical side of things, you know? We'll look at the psychosocial stuff side of things, but we focus mainly on the medical side of things, you know? So what is causing your mood to be dysregulated? Why are you not sleeping? And so you are most likely to have medication as part of the treatment because of our training into looking at what is causing an illness. And so our training is that if someone is depressed and they're severely depressed, then you must consider medication, because depression for us is not something that you go through.
Right.
You know, it's a chemical imbalance in your brain. So the medication is just there to sort out the chemical imbalance. The same way as medication for diabetes work, you know, is to correct your sugar,
Sure.
you know, so that you can be healthy. And so the antidepressant work like that. And so psychologists, they will not prescribe medication. And so they will help you. So you have a conversation, and they try and figure out if there are themes, if there are patterns, if there's trauma, and see how you can deal with it. So it's more like, I don't want to say talk therapy.
Sure.
It's like change therapy, but it's based on the talking. You know, so when you go to therapy, you're not only there to talk, you're there to change, all right? So we're gonna make you aware of certain patterns that you are not aware of, all right, that keep resulting in harmful behaviors, so that you can be able to change your life and change those patterns so that you can be well. So that's, in a gist, the difference, yeah.
Thank you so much for unpacking it so nicely, Doctor. I feel like now I know exactly whom to go to for what.
Yeah.
When we talk about the mental health advocacy or even activism, if you will, how important is it for us in our own community to be that support system for someone who's going through something mentally, be it an illness or someone who's unwell?
Yeah. You know, so we all have responsibility, and for me, I always say that mental health or psychiatry is life, you know, and life happens to all of us.
Right.
All right. I can experience any major changes in my life, and I struggle to regulate my emotions or process things, you know, or be able to bear whatever I'm going through.
Sure.
You know, and so I think the first thing that we must do in the community setting is that we must stop speaking negatively about mental health. You know, like once you say you're seeing a psychiatrist, it's like, why we are shying?
Yes.
You know, why are you seeing a psychiatrist?
Right.
Or I'm seeing a psychologist, why you can't solve your problems, you know? So if we stop speaking negatively about mental health and about mental health care providers, then we are by default empowering people. And so if you have someone who is mentally unwell, you know, whether it's because they are depressed because they are going through such a common occurrence as divorce, you know, it's not to just dismiss them and say, don't go see a psychiatrist if you are battling, you know, encourage them to say, you know what, my friend, this has gone beyond me. I'm not able to comfort you. I think it's better that you see a professional who will help you navigate through this difficult process. So if we encourage it, I mean, I've got kids, and you know, one is it's about to be a teenager, you know, and for me, it's every time I see that she's sad, she's withdrawn, she's battling with something, I always speak to her and I say, you know, I know that you might not be comfortable speaking to me as your mom about certain things, you know, and so we have two options. You can identify someone in the family or in my circle of friends that you trust, that you can speak to. If you feel like maybe they will come back and tell me what you guys spoke about, I'm happy for you to see a professional. So psychologist in my family is just a normal thing. You know, it's like going to a dentist, it's like going to a gynecologist. You know, when are you going to see a psychologist just to check if you are okay? So if we don't speak negatively about it, we encourage it as a normal thing. Like you would say, when last did you go see your urologist? You know, when did you check your prostate? When did you check your blood pressure? And so if we normalize it, then we will by default be encouraging people to not bear the unbearable when there are people who are trained and available to help them bear whatever it is that they're going through.
I get you, Doc, and it's so important for us to already start destigmatizing mental health, right? Because the reason we are here, so many people are even thinking about, there's a trend that's on TikTok now, they call it unalive yourself, which is just another reference for suicide. Or the reason why so many people are so suicidal is because there is a misunderstanding which stems from the stigma that comes with coming to the fore, as it were, and communicating how you are not coping mentally. So, which is why you and I are having this conversation, like the advocacy is so important, that if someone comes to me and has trusted me enough to open up about how they're feeling, I should be able to, at least on some level, comfort them, support them, or send them to you. And where would the normalization then start, Doctor, to now say, please go and see Dr. Chawane. She is going to be able to help you. Because even that recommendation in itself comes at a cost. We lose, like relationships even fall apart because of the stigma.
You know, so for me, I always reflect on HIV. You know, when HIV started, it was such a stigmatized illness. And it was out of control. I mean, when HIV, you know, and like I remember being at medical school, and if we met a pregnant woman who was not positive, we will call each other and say, today I saw somebody who was negative, because everyone was positive. And there was a lot of stigma. A lot of people were not getting medication. A lot of people were not testing because they were afraid that people are not going to be in close proximity with them. People were afraid to touch them. And so the treatment action campaign came in and said, no, it is not infectious in that way. And so they brought a lot of knowledge. And so if there is knowledge, which I know in mental health is scarce, and that's why I'm appreciative of such settings, because we are bringing awareness. And so with knowledge, there was more awareness, and then with more awareness, there was less stigma. All right? And so I believe that if we educate people, all right, about what is mental illness, and if we call it an illness instead of all these alternative things that we're using, like umuntu yahlanya, if you're hlanya, you don't think you need to go see a psychiatrist. We think that for us as Black people, you must go to the church, they must pray for you because it means you might be demon possessed, or you must be left as an outcast because it means you've done something, there was a spell that was put on you. You need to go and see a sangoma so that they can do some rituals. And so we don't call it for what it is. We don't see it as an illness. And if we don't see it as an illness, then we won't treat it like an illness, because we see diabetes as an illness, and there's no one who will say, I'm going to go get prayed for my diabetes. They go and get medication for their diabetes to be controlled. And so if we see mental illness as an illness, then it's easier for us to say to somebody, hey, like I said in the beginning, this is beyond me. I'm not able to help you. I am worried about you. I feel like you are losing yourself. You're not sleeping. You look tired all the time. You are irritable. You are losing weight. You're not coping with work. You're not coping with life. This has gone beyond you. Please seek professional help. And I think as well is how we suggest it. If I'm sitting nicely with you and I'm there for you and I'm showing that I am concerned about you, then a person is most likely to get help. But if it's, hey, I'm tired of you and your nonsense, I think you must just go see someone.
Right.
So it's also how we say it, and most of the time it's like, "Hi, go see someone."
Sure.
And so if we say it in a different tone, in a different manner, it just says, "I don't want to," because I know when I come back, people will not see me the same way.
Right.
And so it's just the social setting. So the family must be aware, work must be aware. There are a lot of employers that have mental health policies.
Yes.
But they're not able to implement them in real life. I've got patients who would come to me and they've been off work and I need to write a sick note for them to say that they were ill. We don't write the diagnosis or anything, but it will, my letterhead that says I'm a psychiatrist.
Yes.
And they're like, no, I don't want my colleagues or my boss or even HR to know that I'm seeing a psychiatrist, because I know they will treat me differently.
That's stigma again.
Yes. And unfortunately, they have come back and say, are you sure this person can cope? And I'm like, yes, I wrote that they can return to work, so it means they can cope, and we will continue supporting them. So there are people who have lost their job because they were admitted in psychiatric hospital. There was a a friend of mine who says, when I went back to work after admission, they just didn't allocate any responsibilities to me for like 3 months, and I had to leave. So she was like, I was frustrated, and so I left because they just looked at me like I'm no longer that person.
Sure.
And so, and it's still because people are misinformed. I want to give people the credit to say, I believe if they know better, they will choose better. It's something else if all the knowledge is there and people still choose the wrong way, then I know that I've done my part. I feel for me as an advocate is to make sure that there is as much information for people to know and understand, and so that whenever they're making decisions, it is informed based on facts.
I like that, Doctor, and that's why we have you here to give people the factual information through this educational conversation that we are having. If you have just joined us, this is Wellness with Will. We are sitting with Dr. Clementine Chawane, who is a psychiatrist and is with us today to talk about mental health and how you can become an activist, and in your advocacy, help save a life, essentially. Let's unpack the work environment, Doctor.
Yeah.
We understand that most people, most corporations have what they now call wellness managers, wellness departments. In some corporations, they'll call it something else, but it all almost falls within that realm. But there still exists on the ground the misunderstanding of how to treat someone who has been vulnerable enough to disclose that they have a mental illness. And because it's not a physical manifestation that you can see, like if I say I've got a sore tooth, this is where they put my filling, you know, that's a different case. But if I say I need a mental health day, I need to go see Dr. Chawane, I'm going to be looked at differently. And as you say, you know, some responsibilities will then be taken away from me, and that's going to cause me to be anxious, to be depressed, etc., etc., etc. So in the workspace, yes, there are these supporting tools, but they perhaps not being implemented effectively. How do I help my colleagues around me? And am I forced to disclose? Should I, or should I keep it to myself?
Yeah. You know, so most patients ask me that, should I go back to work and disclose?
Right.
So one thing is that patients as well stigmatize against themselves. All right, so there's a lot of shame.
Right.
You know, and so I'm going to refer back to HIV. How we also fought HIV, it was when people came out and say, I am positive.
Sure.
I am on ARVs and I look healthy.
Yes.
You know, and so people were like, oh, so I can look like that, you know? And so if we're going to shy away from saying that I am seeing a psychologist and a psychiatrist, then it still remains a thing that we should stigmatize against, you know?
Right.
So I encourage my clients to own up to it, you know? I am seeing a psychiatrist and that's why I'm better, all right? And so I ask them to look after yourself, show up, do your work, communicate, if you are not able to do anything, because already they're looking at you like, she's fragile, or he is fragile, and he won't be able to cope. We are afraid to give him more responsibility. The next thing we hear that he committed suicide. You know, and you find that sometimes that is not even on the patient's mind.
Right.
You know, and so it remains a choice of an individual because there's laws that protect us. All right, so I don't have to disclose. I can disclose if I want, and most of the time we disclose for the sake of support.
Sure.
You know, we don't disclose for the sake of being excused from doing my responsibility. So no, I can't do this. I have mental illness. That's not what we're encouraging.
Right.
You know, it's more about, hey, I'm seeing a psychiatrist. I'm battling a bit with this and that. How can we navigate this? I'm seeing a psychologist weekly. So are you going to allow me to take a bit of time off work to see a psychologist? It's just an hour session most of the time, and then I'll be able to come back to work. So it's just so that the employer can accommodate you. But disclosing, as in go and disclose, I mean, according to the POPI Act, you still can maintain a lot of confidentiality. And I feel like the world, as it is now, it's not ready. They don't know how to handle it.
Sure.
You know, and I have worked with some people who are in HR who says, I don't know what to do with this person.
Right.
You know, we have policies, but I'm afraid that if I give them more work, if I allow them to work as much as they did, that they will have another burnout, they will have another breakdown. And so I don't know what to do. And so what I encourage them in the workspace is that have a conversation. You know, if someone has been away from work for whatever illness, right? When they come back, meet with them and say, how are you doing? How are you feeling? What can we as a employer do to support you so that you can fully recover, and not make decisions without having a conversation with the client.
And it's so funny, Doctor, sorry to cut you, just because I don't want to lose this thought.
Yeah.
We don't victimize the person whom we know is diabetic.
Yes.
If anything, we support them. We make sure when we're doing a shopping list for the office that we get the sweeteners because so-and-so is diabetic.
Yeah.
perhaps we should adopt the same attitude and understanding and compassion, if you will,
Yes.
for people with a mental illness.
Yes. Most so, and the thing is, if you go to, so I work in a psychiatric hospital,
Right.
And when I say psychiatric hospital, it's not like you have people walking around in straight jackets and sedated.
Yeah.
I have people like me. I've got professionals, CEOs, doctors, all sorts of people, who are there battling with whatever illness that they are battling with, but they are well people,
Right.
And if I go to a general hospital where you have patients who are there for diabetes, flu, and everything, the amount of flowers you see in a general hospital compared to the amount of flowers you see in a psychiatric hospital. When I walk around, there are no flowers. And I'm like, but why are you not getting flowers? Someone would say that last time I was involved in an accident, I was getting calls from my colleagues, from everyone, every single day. Now that I'm in a psychiatric hospital, no one dares call me, And it's just the stigma, and some people are like, yeah, we all have problems. Why, when do you need to go into the hospital for the same problem? Because I'm assuming that my sadness is your sadness.
Sure.
That what depresses me is what depresses you. And so if I deal with my depression by going for prayers, I believe that you will be okay if you pray, and so we don't individualize things. And so me and you could be diabetic and be taking different medication. All right, and so you can't just put a blanket on everyone to say, this is how I deal with my sadness. That's how you should deal with your sadness.
Sure.
You should allow people to be and to get the help that they need. And so I feel like, we need to stop being harsh about it, because today it's me, tomorrow it could be you.
Right.
And I always say to my clients, I'm sitting on this power chair today encouraging you, all right? But what if something major happens? I need to have the same grace to sit on the other side and let someone encourage me.
Right.
And not think that just because I am a psychiatrist, then I am protected from being mentally ill. I can become mentally ill. I can become depressed. I can become anxious. I can be addicted to substances, including alcohol.
Right.
All right, because that is one thing. If you are an addict, you will deal with a psychiatrist and a psychologist, to help you overcome, because we see it as a crutch.
Yes.
So why do you need to lean on this?
Yeah.
All right, it means that there is something that is heavy on you, that you're not dealing with it appropriately, and that's why alcohol has become the person you go to.
The dependence, yeah.
And so all of us can. And it starts off with just a glass of wine to a bottle to I can't live without. So it's different things for different people. Psychiatrists don't see what other people will call mad. There's schizophrenic who are disorganized. We see depression, anxiety, we see addiction, we see personality disorder, we see developmental disorder, autism, ADHD, any learning difficulties.
Right.
So we see a lot of pathologies. And so I don't want people to think psychiatrists sees mad people.
I get you.
And we should take that word. We don't see mad people, we see mentally ill people. And a person that previously you thought was mad is actually ill. And they can get professional help so that
illness.
They can be restored. All we want is that we want people to be active members of society.
I love that, Doctor. Listen, I'm going to ask you to please come back to Wellness with Will so we can call it a part 2 of our conversation and really unpack just that last bit you've just mentioned now. The substance dependency that most people go through, which then lands up or manifests as an addiction, that on its own is something that we need to deal with and assist people or support people because the way we've normalized, especially in our African culture, Horai o rata bojala,
Yeah.
and we even term it kiletahwa, not understanding that it manifests in that way because there is an underlying emotional imbalance of sorts. So will you come back?
Definitely. If you invite me, I'm here.
Right, so she said it live on television tonight. She will definitely come back. Dr. Clementine Chawane, a psychiatrist, joining us today here on Wellness World. Doctor, thank you so much for your time.
Thank you so much for having me.
Thank you so much for watching. We'll catch you next time.